Of week 3, and we've been talking about contracts so far. So today we're just going to go over the essential components for contracted providers of care. Different accrediting bodies and surveys have requirements for how many and what services can be provided under contract for the different agencies. I'm not going to go through those because for your agency, hospice and home health and home care, private duty are all very different. So there are different services that you have to provide under W-2 employees and services that can be provided under contract. And they kind of differ on some levels between the different providers. So if you're not sure, you want to check the standards on that, and it will tell you. But what I wanted to talk about are when you are using contracted personnel to provide care, they're not W-2 employees, you still have to have components in place for their contract. So those are the things I'm going to go over today. Essential components of arranged care services will be supported by a written agreement, basically, that says what the services and care are authorized by the agency, how they'll be furnished in a safe manner, how the person is qualified to perform them, and delivered in accordance with the plan of care. So even though you have a contracted staff member, you still have to show that they have been included in the plan of care for the patient because they're providing the care. So if they're providing the care for the patient, you have to show that you have involved them in the plan of care. So written contracts or agreements utilized for personnel under an hourly or per visit basis must include, but are not limited to, the patients who are accepted for care, the care and services provided, the need to conform to all the policies and procedures, including the orientation, the qualification and competencies, as well as a background check, the responsibility in participating in plans of care, kind of like I talked about. I'm reading these from my notes if you can't tell because I don't want to miss any. So how care will be controlled, coordinated, or evaluated. And so that would be whether that's different surveys or audits or check-ins or, IDT or IDG meetings. The procedures for submitting notes, schedules, visits, and patient evaluations. So just because you have a contracted provider of care doesn't mean they don't have to complete documentation according to your policies and procedures or in order to bill. So if you have a contracted care provider that doesn't get their notes in, it's the same thing as having a W-2 employee that doesn't get their notes in, which wouldn't be acceptable, right? So basically it's saying that in some ways, contracted care providers are still held to the same standards that a W-2 employee would be. So the procedures for payment or care or services furnished under the contract, how they'll be paid, the duration of the contract, what they'll be paid, and what services are covered. Responsibility and supervision of personnel. So if you're contracting with a therapy service, you would expect them to have the personnel files and the all of this documentation ready for their employees who are contracted with you. And while you would expect that, just like there are some areas that you may not be 100% on top of, or I'm not 100% on top of, your therapy provider may experience that same struggle. So you want to make sure that you don't wait until survey to ask for those things and then discover that they cannot provide it. So you want to at least know that contracted provider has the information that you need. You can request a copy of the personnel file for those people who are working with you, and that's generally a good practice, especially if you're within survey window. And then you want to make sure that the liability insurance for those providing care is where it needs to be, because for a contracted provider, they're required either by their contract manager or by themselves individually, like myself, I'm required to carry general liability. So you want to make sure that that's in the file, whether you get it from themselves or from who's ever managing their contract, like a therapist working for a therapy company. And then you must ensure that any agencies or individuals providing services under an arrangement have not been denied or excluded from any federal health programs, or had their billing privileges revoked or been disbarred, or have, a denial of or judgment from CMS, basically. That would kind of be an exception, honestly. That might be like if you were contracting with an individual who declined to provide you with their background check or with their OIG or their state, registry search. That would be the only way you would really have a heads up about something like that. So the recommendations are that you want to go through and audit all of the agreements that you have to make sure they have all those components. And then all written contracts and agreements should have evidence of review in the contract. We are going to talk about evergreen contracts versus renewals, but that's pretty quick. So I'm going to cover it today and just leave tomorrow open as a Q&A. So if you have any compliance questions, I'm going to get on here tomorrow and just speak to those. So you can leave them in the comments. You can post them in the group. You can PM me directly. If you have any questions about anything we've covered or anything we're going to cover, I will go over all those tomorrow. So when we're talking about evidence of review, you don't have to have an expiration date on your contract. So if it's a facility contract that you are a hospice and you partner with, it doesn't necessarily have to expire every year on November 17th, right? But it does have to have an annual review where you've reviewed the contracts. They're still in good standing. You've gone through and made sure that all of the areas are still correct. And then the review date needs to be noted along with the initials of whoever's completing the review. So it's easy just to print out a log sheet and go through every year and go through all the contracts and initial what date you went through and what contract was reviewed. The most reliable source of information to ensure that your provider or contracted vendor is not excluded is going to be the OIG website. So if you feel like you don't have all the information you've asked for a contracted person who's providing care and you're concerned, I would go to the OIG website. And then you can also go to the SAM portal, System for Award Management.gov, and make sure if you are missing information that your contracted provider or contract manager isn't giving you, then you can look that up at sam.gov. If they're a government contractor, you can see if they've been denied participation in the Medicare or Medicaid program. So that is a super quick overview of contracts and evergreen and renewal. So that's pretty basic, pretty simple. Are there any areas of contracts that trips you up? Do you have all the pieces in place? Do you feel pretty confident with your contracts? Let me know if you have any questions. And then please drop any comments that you have here in the box. And then tomorrow is just going to be kind of Q&A on anything we've reviewed so far that you might have questions about. All right, thanks.